My name is Aimee Morrill. I'm the South Dakota speech pathologist for Prairie Rehab based in Sioux Falls, South Dakota. I'm coming to you live on Facebook to talk about maximizing your memory. If you have any questions, please feel free to write them in the comment section and I will answer them afterwards. Today we're going to talk about why a speech pathologist is interested in cognitive and memory and different things that we may be able to do for you. So speech pathologists are trained in all matters of the brain, whether it's a normal cognitive decline or if it's something more severe such as dementia, Alzheimer's, Pick's disease. Cognitive decline happens to everybody. The brain doesn't work quite as well as it used to, and some cognitive decline is normal. It is expected. There's not much we can do about it. It's a slow and gradual process. So if you're aged between 40 and 50, you can expect it's going to be harder to remember short-term memory. So you're going to have to develop some compensatory strategies in order to be able to recall things in the short term. Between ages 60 and 70, overall processing slows. So my cognitive ability hasn't changed. I can remember as much as I could in my 40s, 50s with that normal aging process, but it takes me longer to comprehend the information and store it in my brain. A mild cognitive impairment, or MCI, is an actual medical diagnosis where there's a measurable and noticeable cognitive decline. However, it does not interfere with your daily life. You're still able to drive, do finances, and some people still work with this diagnosis. And the reason is they typically work with the speech therapist to develop some compensatory strategies that they can use to continue functioning as long as possible. If I have a sudden change, or it's a change that's affecting my everyday life, then we have probably to suspect some dementia. Again, we can't stop normal cognitive decline from happening, but we can do things to maintain our current ability as long as possible. In order to maintain a healthy brain, we need to have social connections. It decreases our risk for cognitive decline when we interact with others. Unfortunately, in this current situation that we're in, we may be more isolated. You need to make sure that you are reaching out to friends and family on Facebook, email, if you're talking to them on the phone. We still need to maintain those healthy social connections so that you are interacting with somebody during the day. Mental game stimulation. Years back, the biggest thing that people would do, thinking that it would help their cognition, was coloring books, and we saw that in a lot of the facilities as group activities. That is fine to do if that's something you enjoy, but you're not going to have an improvement in your overall cognitive ability with just coloring books. So mental game stimulation, there are some research-based apps that we as speech therapists train our patients to use. The most common ones are Memorado, Neuronation, and Lumosity. Those are all scientifically based and they challenge you in different ways depending on what your strengths and your weaknesses are. Another thing you need to do to maintain your healthy brain is to challenge yourself with a new task. If you have not learned a new language, you can work on that. If you are someone that plays an instrument, you can challenge yourself to play a piece of music that you've never done. So the key is, it's not something harder that you typically do, it's something you have not done, and it's a big challenge for you. Sleep. Everybody needs a set amount of sleep in order to get rid of any waste in our body that causes neurons and plaques and tangles to form in that brain. Because the more cognitive activities we do that requires brain energy, that gets stored up there, and every night that needs to be flushed out so our brain is nice and healthy the next day. Exercises. The latest guidelines are 3 times a week minimum. It's going to increase your problem-solving ability and your mental speed. And the latest research shows it does not have to be vigorous, meaning that if you may be limited, you could still do Tai Chi and yoga, and that counts as exercise needed for the brain. The last key point for maintaining a healthy brain is diet. So the MIND diet, M-I-N-D, is a combination of the Mediterranean and the DASH diet. DASH is a low sodium diet. The whole point of the MIND diet is to decrease inflammation, it prevents neuron death, and it reduces stress, which can harm our neurons and cause them to die. The key components of the MIND diet are having 1 to 3 ounces of fish per week for your omega-3 fatty acids. Nuts, the recommended amount is 5 1-ounce servings per week. That gives you some vitamin B. Olive oil, which is a healthy fat. Berries, and the best ones currently are blueberries because of the antioxidants. 2.5 cups a week is recommended. And vegetables. Pretty much all raw vegetables are good, but spinach is the best because it has a lot of vitamin E in it. So going back to what can a speech therapist do for my memory? If we evaluate somebody that has some questions about their cognitive ability, we're looking at their strengths and their weaknesses, and we develop some strategies. Some of the strategies that we teach people are mnemonics. If you ever played the piano when you were little, you might have learned the sentence, "Every good boy does fine." That's the scales of a chord on a piano. A compass, never eat salty Wheaties. That's the direction that the compass goes. So mnemonics can help with short-term memory. The link method. So a link method helps you to increase short-term memory, and you're able to remember longer amounts of information. If I want to remember flour, butter, milk, typical grocery items list, I can challenge myself without writing it down. Can I go to the store and remember that? Well, if I make a sentence, the flour spilled on the bread, tip the milk, drop the eggs, I can make a sentence containing my grocery items. I have to make it a unique sentence, something that stands out and triggers my brain, oh, these are the items that I needed. The journey method is a method that is taught based on visualization. You pick a room you're very familiar with, such as your bedroom, your kitchen, maybe it's your garage or your workstation. You place the items visually in your head of the things you want to remember. So if I'm going to the grocery store and I want to remember a box of Cheerios, I visualize it on my kitchen table. I visualize my milk on the chair. I visualize the tuna on the floor next to the cat. So you go to the store, and instead of trying to recall those items, you visualize the rooms. I know on my kitchen table I have this item. I can picture my chair, I have that item. I know that the tuna is next to the cat. So I'm visualizing a room, which helps me recall the items much easier. Writing things down. So the physical act, not texting, but the physical act of using pen and paper, writing things down, has shown in some studies to help increase our recall. The point of speech therapy is to determine where you're at, what different strategies we can do to maintain our current ability. If we find out that we have a diagnosis of dementia, a speech pathologist can still help you to determine where you're at, strengths and weaknesses, and what we can teach you to maintain where you're currently at, or give loved ones and caregivers strategies to help you cope with them. The last thing I want to remind people are we need to change up our routines. We become creature of habits, so we don't really stimulate our brain. If you wear a watch, put it on the other wrist. If you cross your legs, do it the other way. If you wear a purse, put it on your other shoulder. That will send different neurons to your brain going, oh, something's different. It'll allow you to pay attention and concentrate. We get in the habit, creatures of habit. When you go into the grocery store, I typically go to the right. I get those particular items first, that's my routine. But if I change it and I go to the left, that sends a signal to my brain, pay attention. It's not automatic. Those are the things a speech pathologist wants to work on with people to keep that brain functioning as long as possible, or teach a caregiver what can we do now that our brain is not working the way we need to. If you would like to talk to myself or another speech pathologist at Prairie Rehab, please feel free to look online for our locations or check out our website at prairierehab.com. Thank you.